Following Erisa's successful heart operation in India, Keith Heart Foundation accompanied his family to their first post-operation checkup at Uganda Heart Institute.
My name is Dr. Lubega Suleiman, working at Uganda Heart Institute, Mulago Hospital. I've had the pleasure of treating Mwazi Erisa, who has 1.5 years as of now, who has recently undergone operation in India and has recently returned. Mwazi Erisa has had heart disease, which he was born with, and was diagnosed at the age of about 6 months. And since then, he has been suffering from this abnormality, and he has had recurrent chest infections as a result of these holes. He has had 2 holes in the heart, which were all severe. He had a VSD and a PDA, which holes were causing a lot of problems. He's born to parents who are peasant farmers, and they come from Wakiso, which is a suburb area, and they've had social issues. They were not able to manage the money to buy the drugs, and in any case the child needed operation because the child was in heart failure. As a result, we came in touch with the Keith Heart Foundation, which is based in UK, and has helped us a lot in the operation, in getting this child operated. We've had to work with the local team in Uganda and the team in UK. Erisa was taken for operation on 18th of July this year, and the operation was successfully done on 24th July this year. The operation was done in Bangalore, in the hospital called Narayana Rondai Hospital, Bangalore, and the 2 holes were successfully closed. He returned to Uganda on 2nd of August this month, and I've had the pleasure to see him today. Erisa looks much better as of today. His breathing is much improved, and I know that his situation is going to improve, and he will not need drugs, especially after about 3 months of the operation. We'll always review him, but we know that he will get off the drugs and he will have a better life. In regards to the operation, I want to thank the entire team of Keith Heart Foundation, and that is headed by the chairman, who is Mr. Eddie K, based in UK, who has had a lot to do with this operation. I want to thank the Chief Executive Officer, Sewamala Monica, who has also helped us a lot in getting this child done, operated on. I want to thank the directors of Keith Foundation, and these include Asha Rukundo, Ivan Kaburahe, and Winnie Naku, who have also done and worked tirelessly to get this child funds for the operation. I want also to thank all board members of Keith Heart Foundation. I want to thank Professor Quresh, who works at St. Thomas Hospital in UK, London, who has also had a lot in soliciting for funds to get this child done. I want to thank also all the surgeons and doctors in India, Narayana, Rondaya, Bangalore, for getting this child successfully operated and returning to Uganda. I want, in addition, also to thank the coordinators of Keith Heart Foundation, who are based in Uganda, and these have been mainly led by Consul Mainuka, whom we've worked with round the clock, working to get this child taken to India. I'd also want to recognize the contribution of Namusisi Jolly, who accompanied the child to India. As the parents were illiterate and could not accompany the child because they could not speak and write any of the languages that would be needed at the airport. Special thanks also go to all the people whom I've not mentioned, but we know that it was a really big team that did a lot to get the organization in place to have this child operated. As we speak today, we have many children who would need help in terms of operation. We know that Erisa, Moaz Erisa, is one of the first beneficiary of this Keith Heart Foundation. But we know that in future we'll be working with Keith Heart Foundation to get many of our children who need this most deserved surgery, life-saving surgery, done. So as we speak now, we have a population of about 2,000 patients with congenital heart diseases. I've not mentioned those who have acquired heart diseases, but we do have a pool of about 2,000 children who need heart surgery. I know that as we work with Keith Heart Foundation, we'll get many of these on board to get the operation, and I know that even through Keith Heart Foundation, we'll be able to get other donors who may help us to operate on these children. Throughout the whole process of getting Moaz operated, we've had many challenges, and these have been spreading. They've included transport, even just transport money to get Moaz always to hospital for the various checks, for the processing of the passport, travel, maybe to the airport. All those are challenges, financial and administrative challenges that we've met along the way. We've also, like many other patients whom we deal with, we have problems of literacy. Many of our people may not be able to read and write, and that is one of the problems that we encountered with the Moaz family, in which none of the parents could read and write English. And so we had to get another person to accompany this young child to India. So in doing all of this, the local team has been very helpful, because they've helped in processing the passport. They've literally done all the activities, bring the child to the hospital whenever need arose, and traveling to the airport. They've really done a lot in processing all the paperwork. So we hope that we'll be able to move on smoothly in future, because this being the maiden child, there have been a lot of learning experiences, and hope that in future it will be more smooth as we liaise with the Keith Heart Foundation to take more. Process of taking Moaz this time, we've had an expedited process in which the child was taken on 18th July and operated within 6 days. You realize that the child spent only 2 weeks away from home. This has been a very good experience, because we've had to reduce costs by reducing on the time of stay away from Uganda. So this has been really, I know it has had a lot of challenges, but it has had a lot of impact, because most of our children usually will spend between 3 to 4 weeks in India. By this time that Moaz was able to spend a short time, I'm sure this was very important in reducing the costs, and that means that we are able to take on more children in the Heart Foundation and in terms of sponsorship.
This is the Moaz homestead in Buloba, 15 miles outside Uganda's capital, Kampala. The house is crowded, has poor ventilation and poor sanitation.
nonyeze ebikajja ebirungi.
The family has many mouths to feed, meaning that malnutrition is a problem, especially for baby Erisa, who has serious health issues.
Nze Moses muwazi, nze nnyini waka wano we tuyimiridde n'omukyala wange ono Gertrude Batamuliza. Ffe tuzaala abaana be tulina bali abaana 7 naye nga tulinamu n'abalongo. Kati abaana be baliwo mu kaseera kano, ababiri bali ku ssomero. Waliwo ababiri be tulabirira okutwalira awamu be baana nga 9. Saidi y'abaana bange ono ye mwana asembayo mu baana bonna benzaala. Oluvannyuma lw'okwetegereza nga amaze akaseera kaneneko nga atutawaanya, oluvannyuma lw'emyezi ndowooza gyalinga 8 n'atutawaanya nnyo tuyingira buli ddwaliro, naye abasawo abalala ne batusindika e Mulago. Twatuukibwa Dokita Lubega n'akizuula nga ku mutima gw'omwana ono kuliko ebituli 2. Eddwaliro lyaffe wano e Uganda kyeryali litasobolera ddala kuba nti liyinza okujjanjaba omwana ono. Lubega n'atufunira ab'ekitongole kya Keith Heart Foundation. Tuwulira essanyu lingi nnyo okuba nti tufunye obuyambi, ekintu kitwali tutajja kusobolerako ddala wadde akatono bwe kati. Era tubeebaza nnyo, beebalire ddala buli omu mu kiti kye. Akaseera kano tuzizza omwana waffe mu ddwaliro ne bamutukeberera bulungi nnyo, ne batugamba nti ateredde. Kyo tukyebaliza Katonda n'okutwalira awamu n'abasawo abatukoze kituyambyeko. Beebale nnyo, beebalire ddala. Enjawulo yo weeri kubanga kye tulinako okwetegererezaako okuva olubereberye ffe nga bwe twajja tumulaba ne kwe twalabira nti ddala kituufu alumizibwa. Yayinanga ekinnya wano mu lubirizi ku saidi eya kkono, nga naye nga kikuba nnyo mu sipiidi ey'ekizungirizi. Kati akaseera kano kyasazeeko, tekikyalabika.
Amannya gange nze Juliet Nalwanga, ndi mulimwana wa wano mu maka ga wano, naye omwana waabwe yali mulwadde omutima ne bamutwala India, naye omwana kati ali bulungi, yawona mulungi nnyo, kati yatereera.
Nze Deo Kibirige mbeera Bukasa Bukulu, ndi muliraanwa wa Mwami Ssaalongo ono. Bazaala omwana waabwe n'abanga taggwa mu mulwadde nnyo. Kati bamutwala e Mulago ne babagamba nti mulwadde wa mutima. Kati nali ndi awo nenfuna abasawo abankubira simu, nali simanyi nti bawaayo simu yange, namba yange, ne bankubira ne baŋŋamba nti muliraanwa wawe oyo tumwagala aleeta omwana bamutwale India okumulongoosa. Najja ne mbanoonya ne mbalaba ne mbategeeza ne bagenda. Omwana waabwe ne bamutwala. Kati tugenda okuwulira nti bamututte India okumulongoosa, naye kati bamukomezaawo, embeera ye nungi kati.
Amanya gange bampita Namusijole, nga nze anti wa Muwazi Erisa. Kati nali awo ne baŋŋamba mperekereko omwana omutwala India okumulongoosa, whereby nga bazadde balina problem ya language barrier. Kati naye nga abatuyambako okugenda India okumulongoosa ba Keith Heart Foundation, whereby twebaza nnyo kubanga ffe twatuuka India tetulina gwe tumanyiyo, naye baatufaako olw'ensonga twatuuka eyo care yali nnungi, nga tuli emmere bulungi, nga wayonjo, nga batuwa good care, ne batwala omwana okumulongoosa. Operation yalonga ennaku z'omwezi 24 mu mwezi ogw'omusanvu, omwana bamuggyako ssaawa 2 ez'okumakya. Mba nkyali awo ne bampita ku ssaawa 7 nti the operation was successful. Nengendayo mu HCTU yaabwe ne mulaba. Bwe navaayo nga buli kanaku ngenda mulambulako kumala ennaku 4 ne bamunziriza ng'omwana kituufu bamulongooseza nga talina bulumi bwonna. Ne tweyongera okwebaza Asha ne group ye yonna gyakola naye kubanga batusupporting nga tetwalina busobozi bwonna, we had no money, nga tetulina de ssente sobola genda India kuba yatuyambako ne tugula passport byonna byonna bebabitukolera. N'olwekyo twebaza nnyo organisation ya Keith Heart Foundation in UK. Mwebale nnyo, mwebale ddala.